there, welcome to Health Options, the program that not only tracks government policies on health, but helps you with the right information you need to make informed choices about your health. Thanks for of disease in the country. This was in the wake of the arrival of Moderna and the Johnson & Johnson vaccines, expected to enhance federal government's efforts to get more Nigerians vaccinated in order to achieve herd immunity against the disease. From the logistical preparation for the storage of these vaccines, efficacy levels to the rules governing the administration. Stay with us for these and more on this episode of Health Options as we take a look at the country's second phase of COVID-19 vaccination. If you're just joining us, this is Health Options, and our attention is on the country's second phase of the COVID-19 vaccination. And I have the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, on the program to take us through issues revolving around this current stage of the COVID-19 vaccination.
The federal government has invested heavily in making sure that we not only certify the right vaccines that are safe and effective for use in Nigeria, but also that when they get to Nigeria, from the national level all the way to the local government and the health facilities, that the cold chain equipment have been procured, they are functional, and they will continue to keep the vaccines at temperatures that have been recommended by the manufacturers. So all across the land, we're in the process of finalizing the installation of cold chain equipment that can keep vaccines in +2 to +8. So this has been more than 90% completed. We hope that by the end of 2021, we'll be able to finish that, so that in each political ward, you have at least one functional cold chain equipment in the primary healthcare center, the general hospital, or in some instances, a tertiary health facility. But apart from that, most recently, in anticipation of donations from the COVAX facility and some developed countries, we've been able to get ultra cold chain equipment to store these vaccines that require ultra cold chain environment. So temperatures of -50, -80 degrees Celsius. These are not common or normal temperatures that we've used in Nigeria. But President Muhammadu Buhari approved the procurement of these vaccines, this cold chain equipment, and this cold chain equipment are already deployed in the states. We're finalizing the process of installing them. I mean, they are more than 98% installed. Only a few states are just completing that process of installation. Now, this is what gives us the guarantee that the vaccines that we're taking to the communities as potent, that they are going to be safe and they're going to be effective against COVID-19, irrespective of the variant. They'll be able to reduce the severity of the disease. They'll be able to reduce the number of people who will need hospitalization and the number of people who will die from COVID-19. So it is an immense opportunity for Nigerians to avail themselves of these jobs. You can't put a price tag to a life, right? So in the end, what we've done is gone through the usual procurement processes and made sure that we got the best prices for this equipment. In the end, what we're comfortable is the fact that this equipment are available. We're comfortable with the fact that this equipment are functional. We're comfortable with the fact that we're going to be delivering potent vaccines to all Nigerians, and we should be very proud of the proactive action of the Presidential Steering Committee on COVID-19, the Federal Ministry of Health, and National Primary Healthcare Development Agency. We have started the second phase of the COVID-19 rollout, except for about, as of today, I think about 7 states are yet to fully commence, just because we've told them that they have to make sure that all of their backup plans for their cold chain equipment are functional. So before we send you vaccines, you need a functional ultra cold chain equipment, right? But apart from the ultra cold chain equipment that you have, you also have to have a backup working freezer and then a backup chest freezer. Just because if for any reason, right, you have a malfunction, you have, backup plans. That is something that we've mandated the states to have. This is the reason why we've not deployed vaccines to, just about, 7 states or thereabout. Again, just to make sure that at no point in time are the vaccines exposed to any conditions that might affect their potency. So very strict with those requirements. But in terms of the rollout, what we are seeing is states really being excited to start the process of giving out the vaccine. So you may recall that we got over 4 million doses of the Moderna vaccine. We got about 700,000 doses of AstraZeneca, for the second doses, and then about 177,600 doses of the Johnson & Johnson vaccine. So we have, a hodgepodge of vaccines that people can choose from. But one thing that is very clear is that all of these vaccines are safe, they are effective, and that what guidance we're giving to the states, and the states are abiding by this guidance, is that if you're coming for your first vaccine, take the Moderna vaccine as first dose, take it as second dose. If you took the AstraZeneca vaccine, anytime before July 8th, then you are due for your second dose of the AstraZeneca vaccine. So go to the health facility and you can be given that, second shot of the AstraZeneca vaccine. And then we've also mapped out specific areas where we want to give the single shot Johnson & Johnson vaccine. Why? Because in those areas, we believe that it will be more difficult for people to get a second jab, just because they are in security compromised areas, hard to reach areas. So any opportunity that you have to actually get them vaccinated, then you got to grab it with both hands. This is exactly what we're doing.
There are also rules governing the administration of the COVID-19 vaccines that you should know about for your safety.
People should not, try and get, additional vaccines after they've gotten their 2 doses of the AstraZeneca. And then we've been clear to say that if you take Moderna vaccine as the first dose, take it as the second dose. If you took AstraZeneca as first dose, also take it as the second dose, right? It doesn't give you any added advantage to finish taking AstraZeneca and then you say, oh, you want to increase with Moderna and then the Johnson & Johnson. We do not understand fully what those interactions are, and for the meantime, that type of combination is absolutely prohibited, and we're calling on all Nigerians not to do that. We are confident about the immune ability, producing ability of the vaccines that are being used in Nigeria, and there is no need to add additional different types of vaccines just because you want to increase your immunity. That has potential health effects that we do not understand. The body could react in ways that may not really be optimal for the individual. So I will call on all media houses to also convey this information, that people should not try to mix and match the vaccines or get additional doses of the vaccine beyond what is required.
It will interest you to know that those in hard-to-reach areas are of high priority this time around. But what mechanism has been put in place to ensure this?
For the first phase of the vaccination rollout, we targeted health workers, frontline workers, strategic leaders, right? So those individuals typically live in the most urban areas, right? But in the second phase of the rollout, because we now have the Johnson & Johnson vaccine, which is a one-shot vaccine, we'll be targeting people in hard-to-reach areas. So people who typically live in mountainous areas, riverine areas, people who live in security-compromised areas. Because you now have one opportunity to go give the jab and then you pull out, we've been able to work with the Grade 3 geographic information system. So we'll be able to map where these communities are, and we're going to be deploying the Johnson & Johnson vaccines to reach them. So we're prioritizing them for the Johnson & Johnson vaccine. And because we are clear about how we're going to be able to meet them, we feel pretty confident that we'll be reaching this hard-to-reach community, so that no community, no individual is left behind just because of where they live. One of the advantages of actually having the electronic management of the immunization database is because once you have taken the first dose of any vaccine, your data is already there, captured in the database. So when you come and you want to say, oh, I want to take a second or a different vaccine, well, your name and your details will be pulled up and will say, no, it's not going to happen, right? This is why it was great. It was a great idea that right from the first phase, we actually used an electronic database for the very first time in our country to capture these types of mass vaccination campaign. So people who have already finished their second dose will not be able to get a different vaccine, right? And what it also means is that even if you want to use a different name, you cannot. If you want to use a different phone number, you cannot. There are different sort of stop gaps, barriers that we have put in the electronic management of the immunization information that makes it difficult for people to be able to beat the system. But apart from that, we are all aware of the fact that Nigeria has procured almost 40 million doses of the Johnson & Johnson vaccine. The initial doses that we brought, that were supplied, the 177,600 doses, is just the first consignment, just symbolic, right, out of 40 million doses. So eventually, we're going to have so much of the J&J vaccine that it makes no sense for people to go to the hard-to-reach areas and wait just because they want the Johnson & Johnson vaccine. It's going to be available even before the end of this month. We're going to get additional 1.2 million doses of the vaccine, and then every single month thereafter, we're going to get additional vaccine. So the J&J vaccine, if it is a preferred choice of Nigerians, is going to be available. But even apart from that, other vaccine types are going to be available.
How much knowledge do you have about the various vaccines and their efficacy level?
So in terms of the different vaccines, it is difficult and really not very scientific to compare the efficacy levels from one vaccine to the other, because there were different clinical trials, different settings that resulted in those efficacy numbers. So it's like comparing apples and oranges when you're trying to compare the efficacy level, say, of Pfizer, Moderna vaccine with the Johnson & Johnson and AstraZeneca. No. So it's like, it says two different people compete in two different sports against different opponents, and then you now begin to compare that one is faster, for example, than the other. It depends on, the competitors, right? So if you are, for example, if you are in a clinical trial, the results that you get are localized, they are contextual to that clinical trial. So you cannot compare the results against a different clinical trial that also involves a different vaccine. No. What you can do, for example, is have those numbers to give you a sense of how efficacious that vaccine was within that clinical trial. For example, the Moderna vaccine, the efficacy level is at 94%. the Pfizer level is at, the Pfizer vaccine is at 95%. So very, very, close in terms of their percentages. And for the AstraZeneca, based on the study that was done, the level of, efficacy can reach up to 80%, if you are able to sort of provide a longer duration between the first and the second doses. So in the 70s after the first dose, but you can approach even close to 90% if you give a timeline of up to 12 weeks between the first and the second doses.
What about the Johnson & Johnson? That's a single dose.
Yes, the single dose Johnson & Johnson up to 67% has been provided as the efficacy level. Again, it depends on the different conditions that were provided for the clinical trial. What we're saying consistently is that people need to take the opportunity that has been presented to them to get vaccinated. Right now we have vaccines that are available. Some of these vaccines have been donated. We're not sure about the availability of these vaccines from those who have donated. Those that have been procured are also available. So people should make hay while the sun shines, right? And grab the opportunity to get vaccinated. And we're experiencing a third wave. Some countries are already experiencing a fourth wave. There are people who were able to escape the first and second wave in Nigeria. But with the third wave, if you're listening very closely to the news, you can see how many notable Nigerians are dying from COVID-19, right? And there's no escaping the fact that there could be a fourth wave. So even if people say, oh yes, I've been able to escape the first and the second wave without a vaccine, when is it that you could get infected with the virus? Is it in this third wave? Could it be in the fourth wave? Why would you take a chance, of getting infected with the virus and you suffer severe disease and that could even lead to death? And in some instances, even if you do recover, there's what we call long-term COVID, right? Where you continue to have some symptoms as a result of the infection, and those symptoms could persist for life. Why would you want to risk debilitating long-term disease when there's a vaccine that can clearly protect you against the COVID-19 disease? What COVID-19 vaccination does is to reduce the severity, reduce the chances of hospitalization and death from COVID-19. What it doesn't guarantee is an infection. So even after you've taken the 2 doses of the COVID-19, you could still get, infected. This is what we call breakthrough infection, right? Because the vaccine is not perfect, right? But because you've been vaccinated, there is the chance that the symptomatology of your infection is going to be very mild, right? So you have just mild disease. Sometimes you may be completely asymptomatic, right? And that is exactly what is necessary for you to understand that the vaccine actually works. You could get some mild illness, but it's better to get mild illness than to have severe illness or even death, right? This is why we're encouraging the vaccine, and we've developed this vaccine within record time, less than a year. So over time, of course, there's always that opportunity to even improve on the performance of the vaccine, right? But it's very, very critical that people understand that even though you've gotten the vaccine, that you should still protect yourself, observe the non-pharmaceutical interventions, right? So that you protect yourself and you protect your loved ones from the infection. Wear your face mask, observe social distancing, hand hygiene, so that you don't contract the virus and then you don't be the source of the virus in terms of transmitting to your loved ones. Whether you have comorbidities or you don't, COVID-19 is still a dangerous disease. But what we have observed is those who have comorbidities are more likely to die from COVID-19 because it worsens their situation, because they already have a compromise in terms of the biological systems, right? That they have. COVID-19 is an added layer, an added burden to their system, and that makes it easier for them to have severe disease, and they will die. So yeah, absolutely right that this is a concern. So whether you are hale and hearty and you don't have a comorbidity, if you contract COVID-19, it could still be dangerous. A lot of people who have died from COVID-19 don't even have comorbidity. What we're just saying is that if you have a comorbidity like diabetes, hypertension, heart disease, cancer, then you are less likely to survive COVID-19, and this is why it is important for you to get the vaccination. These vaccines are safe. These vaccines are effective. Nigerians who have not availed themselves of this opportunity should get over their doubts. They should ignore the conspiracy theories, right? And instead make sure that they actually go all out and get the vaccines. Over 2 million Nigerians have already taken the vaccine. So, you know, that's 2 million evidences that these vaccines are safe and that these vaccines are not lethal. We have gone through due diligence to make sure that we got the right vaccines for Nigerians. And there's no greater demonstration of that safety than what Mr. President, Mr. Vice President, so many governors, so many traditional leaders have already done in terms of demonstrating in public that these vaccines are safe.
So how do people get the vaccine? Where do they go to? Can you just tell us now?
So, you know, we've published the list of designated health facilities in every local government where you can go and have the vaccines, right? You can see that in the media. It's also available on our website. In every, you know, primary healthcare department, you know, at the local government level, those information are available, and people can also register. You can get to the NPA-CDA website and register to have your vaccination. You can actually schedule what time you want to take the vaccines, and then what day you want to take the vaccine, and then you can just walk to that specific health facility that either exists near your workplace or near where you actually live, so that it's more convenient for you.
That does it on this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. Go get vaccinated if you are yet to, and continue to observe the safety protocols. I remain yours, Rabi Abdullah. Thanks for your time. Hope to see you again.
Information is power. Everyone wants power. So feel powerful with the NTA News mobile app, the one-stop information center. Real news at your fingertip. Be the first to report by uploading first-hand information on the YouReport link, and be the first to know by simply clicking on any of the links on the sidebar for headlines, domestic and foreign news, economy, security, politics, sports, and more. Stream live on your smartphone and tablets and stay connected. It's pretty easy. Simply download NTA News app from your Google Play Store and you're good to go. NTA News mobile app, your access to real-time information.
The act of making something more beautiful by adding ornaments to it